Dr. Javed is a consultant anesthetist working for the past few years in Tamil Nadu and Pondicherry. Here he is with us to discuss on a few topics. Welcome, Dr. Javed.
Yeah, thank you, ma'am. Yeah,
So today, shall we go ahead and discuss about smoking and the influence of smoking on, especially focusing on cardiac health, how it is getting impacted, and what are the things we can do to reverse it, or um, how to educate the public regarding the impact of smoking for on the cardiac health.
yeah. Actually, the smoking, there are more programs to quit smoking, but people take it very lightly, and especially in youngster, where they easily available to them to smoke. And another thing is like the media. It's very prone for them to smoke for the style or the generation which makes them to smoke.
Yeah, it has become a trend.
And there is not only
Mhm.
that's
Mhm.
there is no like it doesn't cause only cardiac problem, it causes the entire problem. Entire smoking causes the cancer. There is a cancer and COPD and cardiovascular problem and stroke. There are many problems, DVT. So like it almost takes for people who quit the smoke and he wants to be live a normal life. At least he takes for 1 to 5 years to normalize his whole system. So this many problems and metabolic events are there in that particular tobacco and its content. And there is not only the tobacco content, there is more contents are there in cigarettes, which make you to your CNS to stimulate and gives the relaxation. So it should be cut off by individual only. If there is a program by conducted, so many programs conducted by government, but I think so. It should be the limit with the individual, and so many helplines are there and alternative nicotine chewing gums and nicotine. Go to the doctors and consult for the quit smoking. They should only realize that we should quit smoking. And like for the cardio problem, the smoking in young generation, it is the cause for the sudden cardiac arrest. So what it does it when you smoke a cigarette, it actually it makes it triggers the clotting factors in the blood. So there is a acute chance of acute coronary syndrome, that is myocardial infarction. And this is how the process it takes. Yeah, then it also has carbon monoxide with this. It takes at least 48 hours to eliminate from our system. And for the cardiac event, it's at least it takes 1 year after quitting the smoking. It takes at least 1 year to normalize your coronary system. And anything you want to ask about that smoking? Then?
So, as you told, to sum it up, main cause of impact of health due to smoking is based on the blood vessels, the small blood vessels. It impacts the blood vessels, and to add on to it, it makes the blood vessels, small blood vessels, endothelium lining the blood vessels very sticky. So everything gets it gets stuck to the blood vessels, and it's a cause for heart attack and stroke, everything. As you very well said,
Eh,
uh, yeah.
Yeah, actually, it's a microvascular thing, and it stimulates the cardiac. So the rapid heartbeat, there is more chance of formation of thrombus. So that already a plaque is formed, so it easily in just attached to the plug and it forms the clot acutely. So there is the more chance of acute coronary infection in by smoking. And it doesn't have only a single property. It has around 500 chemicals around in tobacco.
Yeah. It's not only
So this
nicotine.
toxins also trigger. Yeah, this toxins also trigger the factor and does the vasoconstriction and others. So the acute blood flow is cut off.
Yeah, as you told, blood circulation is slowly hampered and tends to uh, ultimately stop.
Ultimately stop. Yeah,
As you told,
it's
the things
already
like
there will be a in metabolic disease. It is like diabetes and others. There will be a gradual, but smoking people there is no such as gradual. He can get a cardiac attack anytime, anywhere. It's like not gradual for them. It is like very acute.
definitely. So they may not even realize. So this is happening.
Yeah, they will not realize until they feel they don't realize about it because it's not a chronic problem for them. If a chronic problem it comes, so if he has a cough, so he will have a symptom. There is no any symptom such as he'll be having his own enjoy. He'll be having his life. But this event is very acute. No, they cannot suspect anything about it.
Definitely. And as you told, in addition to nicotine, we all think people think it's just nicotine which is damaging. As you told, there are a lot of hundreds of chemicals which is all mixed up in that composition. So each one is having different impact on different organs and are causing different diseases.
Y-
So it's
Yeah, yeah, sure.
multi-fold.
So that should be the only problem to trigger everything.
Yeah, this is the same for passive smoking also. If we are exposed to passive
Yeah,
smoking,
yeah, passive smoking. Yeah, the active smoking. The person who stands near him, he consume more than him. That's the problem with the passive smoking. He doesn't heal himself. He kills the others also. It
which
is
is
a social thing
Mhm. Mhm.
to stop the smoking in public place at least.
Already many places they ban like smoking in public places, but still, if it had been a baby or a child, they cannot avoid a parent. And if it's a mother who's also breastfeeding and she is also happen to be a smoker, then there's no nothing to the child can't escape it.
Yeah, yeah. The child code, the I think so. There should be some strict implication in public smoking awareness because the people take it very light. There is a law to not to smoke in the public, but there is. I don't think so. It is very implemented everywhere.
Hmm.
I don't think so. It is implemented everywhere. So the people smoke everywhere. I
Yeah.
see people smoke everywhere.
Yeah, in many public places when we go itself, the smell and the amount of we can just sense it, and immediately we get something like cough or we maybe
Yeah, yeah,
feel.
yeah.
Mm,
So there should be a little cautious for in our society about it, and some little common sense for the individual
yeah,
to not to smoke in a public.
Yeah, definitely. That's very well said. So, what else we are going to discuss today, sir? Like, we can even go ahead with some topics like whatever you wish. Uh, Maybe the IT industry, right now, people, a lot of people, like maybe around 40% of the population, they are planning to be in IT, or they are already in IT field, or some kind of work where they continuously sitting in a stretch of time for long hours, and they can't move and always focused on the watching the screen, and eyes having been focused on something to do with work in a computer or mobile, say. So, what are the impact of that
Yeah,
on human body?
it's actually a wonderful topic to discuss. Uh, Actually, uh, hmm, the person who sits more is all is equal to who has diabetes and who smokes. The risk factor are more equal. The people who sits like IT, they are more prone to like more problems like say, such as stasis of blood. There is pooling of blood. There is more chances of formation of thrombus. So this all mechanism can happen in them. So how to come out from this? They should take at least 30 minutes gap while in IT they'll be programming at least for 30 minutes. In the 30 minutes they should stand for a while, or they should walk at least to go to somewhere to take a mobile and can talk anywhere. Like they should only come out of it. They should know the what is happening to them. That's the thing. And there are more researches that shows that more sitting is very prone to that cardiac arrest and others. Already I told about the pathogenesis of it. It entirely shut down the your all mechanism because your metabolic is very low. Your metabolic function is very low, and you will not be doing any of the activities. Your cardiac output is low at that state, and already blood will be pooling from your lower limbs. So this all can cause that stasis, and some can trigger the embolus and form thrombosis, and that can discharge into your coronary vessel to form a cardiac attack. So it is very danger than smoking.
Yeah. Maybe, as you told, diabetes and maybe another chronic disease, both put together, the same kind of risk they have, but they may not know
Yeah,
until it's too late.
yeah.
Maybe. Mm,
There is no awareness for this actually, because we cannot judge a person by its look. Already BMI is there, but BMI doesn't accurately tell how much fat is there in you. So the person who sits, he should only we should give some awareness to them, because they might doesn't know about anything about this much of metabolic event can happen while sitting for a prolonged period.
yeah, our body is meant to move, and our joints and muscles, everything are supposed to be moving. It's meant to act. So keeping it immobile, it's like traveling in an aeroplane, it's 8 hours a day, maybe.
Yeah,
Mm,
but in a day it's okay, but we cannot prevent anything in the day. But it should be not improvised. Daily routine we cannot do it. People thinks that he is not a smoker, he is not a diabetic, he doesn't consume alcohol. But this doesn't imply that you should not, you can sit for a prolonged period,
mm,
because that predisposed to same risk factor like smoking.
yeah,
But the thing is, no one has awareness about it.
yeah. Yeah, of course, we are talking, and many of them have been focused yet on this topic actually. And even students are sitting for long in classes. Nowadays, when they go to higher secondary or 10th, or 11th, 12th, they continuously sitting in one single room. They don't have PT periods. So that's another like IT professionals and even students now start to sit continuously and after
No,
Hmm.
this awareness program should be created in all corporates and all education system at least. While in a class, it is like a 2 hours class or 1 hour class. In between, the teacher can ask them to stand for at least 5 minutes. She can take the class, so they can at least listen. At least they cannot sleep or they cannot sit. It's nothing wrong, I guess. And in IT, there should be some awareness to that peoples at least, like they are already educated. That corporate world, they should know the basic thing that we should not be in stasis for a long time.
It is like just the heart is pumping, but none of the cells or anything is moving. So it is just going against the laws of nature and
It is also laws of nature. It is against the gravity.
yeah.
So everything making your blood to pool. There is no active to go back to your heart to pump it over all organs. It is like already all bloods are like stasis.
Yeah, it is like it is just the opposite of what is supposed to happen.
Yeah, exactly. Because like if your, I think so, your calf muscle acts as a secondary heart. So your cuff muscle activates. That is a lower limb heart. I prefer generally prefer that pumps the blood to heart, and the heart pumps the blood to the entire organ. But if you're not using that any of the thing, how does it work? It is a burden to the cardiac thing, and it has a more stress, and it does the double of the job. So it is like you're giving stress to your cardiac muscles.
Yeah, definitely. And people think that he had never smoked, he has never drunk, or never been to like any other which is not supposed to be done, or he's eating well, and nutrition, he's exercising, everything is there. But that if they are in a stretch of 8 to 10 hours in a place and not moving, that's supposed to be the highest risk factor, as you told. And all the other factors put together, it comes as a single in a single shot with just being
Yeah,
in bed for hours.
yes, like you said, it is like multifactorial. It is not a single event. It day by day it creates. It is like a slow progress only, but it is not like people who smokes and get acute. Acute. It is not like that. It is like a gradual process. Like it is formed like gradually by day. It grows and it puts more stress for your cardiac and other organs too. Or other organs are not perfused very well. Like if your heart is like pumped and it is the blood flow to the entire organ is like very well perfused. But your cardiac and if your cardiac is poor, the output is poor, and like entire organ is not perfused, and you will be getting wasteness of other organs too.
Yeah, definitely. And nobody would expect that person will may have some drastic kind of a very emergent situation they will be put in a future. Nobody would expect actually because he'll be
Yeah, yeah.
young, he'll be
And
having a healthy lifestyle. Seems to be well, everything seems to be good from outside, but inside for long decades or maybe 5 to 10 years or more, they would be in continuous like the degeneration happens in the system slowly, and one day it's suddenly
yes,
black.
yes. And recently also there was an article like the person who drives the car, like it is an automatic car. So he doesn't use the leg. He will be using his right leg for the thing, and the left leg is rested. He's been continuously driving the car for 8 hours, and suddenly he developed DVT symptoms, and within 8 hours he landed up with a stroke. So this many things are happening with you being sitting for a long time.
Yeah. And we think it's not a big topic or it's not what the big deal and it's nothing to be given importance, but that makes all of the difference.
Yeah, that's make a sentence also for sure.
Yeah. Anyways,
Uh,
do you want to add more information, anything like that, sir?
yeah, the people should know what is the difference between the cardiac arrest and myocardial infarction. That is called heart attack. Heart attack is like where your blood flow is cut off from which supplies your heart. The blood supply to your heart is cut off. There you'll get a heart attack. Cardiac arrest is where your heart is temporarily stopped. It's not a pumping the blood to the entire organ. So there should be awareness between cardiac attack and cardiac arrest. The cardiac attack, there will be some symptoms like syncope, and there will be sweating or pain related on exertion on everything. The cardiac arrest virus is like there is no any symptom for the cardiac arrest. You can get the cardiac arrest uh, anytime, anywhere, like you're exerting, you're giving exertion. So this thing should be known, and for the basic cardiac arrest, there should be some safety measures around everywhere. Like now, the young peoples are getting cardiac arrest uh, while doing gym or some sports activity, playing tennis or some random activities. Like people who jogs or like not jog actually, like people who does the marathon event. This thing, all they should have some basic awareness about how to manage cardiac arrest. If a like they should know at least some basic life support BLS, or that should be awareness to the place where people uses. There should be some provider or everyone should know about the basic needs. It is like first aid to first aid kits the peoples are having nowadays. It is like that. The people should also know about the basic life support.
Definitely, sir. And I was talking about this with one of my friend who's also a medico in US. So she was like, "What is it? Like, it's very common here. Every person in the city or state knows what to do when anything happens like this. This become a norm there. It's in the teaching. It's in the uh, academics. It's there everywhere. Even if they are not educated, they know. So every one of them they know. And in every street there is an
Yes.
AED. So whatever happens, there is immediate response, and it has become like a protocol. It's become like a traffic signal or how to act when there is anything. So it become like how the fireman work. Everyone responds to anything event like this anywhere. So she was asking me, why is it you're giving so much importance to this? She was asking me. I was like, Here it is not like this. So people needs to be educated. Even doctors, we learned it around maybe 25 or 26 years old, and we also need a kind of a continuous training, and we are all taught late. And the schools and the colleges during the undergrads, there is no proper training for this. and in any other, if they take any other field of other than medicine, they are not even exposed to this. Working professionals, they're not aware. Only some kind of government servants like maybe police and fire station workers and few other paramedics, they know. So the ratio, if it is in US, the ratio is everyone knows, like the ratio is maybe 100%. Here, maybe I feel it is just maybe 2%. Or what do you think, sir? Like, how much would be the percentage of BLS providers here in India?
BLS providers, I think so. You're almost like all health workers also. I doesn't know. Like all paramedics also doesn't know. I guess here there should be some awareness to the people. It randomly, I guess it will be to 2 to 3%, as you said.
Yeah, yeah, definitely. This ratio is very less. And that's why I told her that this we are doing it just because to create an awareness, and people have to be motivated for this, because it's not in the curriculum. Government is not employing it as a like a mandatory thing for a citizen. To be a citizen, this is not mandatory, so there's an option. So nobody is yet to explore this full time. So let's see how this goes. And as you told, definitely people have to be educated continuously. So in the school curriculum, college curriculum.
Because now the events of cardiac arrest is more while comparing to the previous era. Now it is very prone to get a cardiac arrest. So how we manage is like we should educate because there will be no doctor or everywhere we cannot be. There will be no doctor. So at least general people should at least have some knowledge about it. They cannot treat the entire thing. At least they can manage to bring the people to the hospital. At least how like management of like cardiac massages or giving that to them. Some basic needs they can do. And AED, the AED should be at least it should be there in some more public places because there I don't see any AEDs here.
Definitely, it is there in few malls, but what's like the AD will be in one corner. People have been never trained or never trained to even switch it on, or to charge it, or
Mm.
how to use it. Of course, the manual is there displayed in the AD pads also, but still, and they have never been trained to use it, and they have to search for it. So it may be if it happens in one floor in the mall, they have to go all the way and need to search it and find it. Maybe it may not be working, or some problem may be there. So this is the condition here. As you told, AED should be installed every public place, every floor in any building, mall or corporate. So this should be made mandatory.
And also be educated to the peoples how to how to use the device.
Definitely.
And because the cardiac arrest is something more prevalent to anyone. So the people who's educated, there will be a less chance of cardiac mortality.
Yeah, definitely, sir. And we can improve the survival rate. And if people
Yes.
around us have knowledge about BLS and basic life support, resuscitation, chest compressions, and rescue breaths, definitely that's a life saving thing. And creating a safer environment at workplace, safer environment at schools and colleges and public places also, where there is a lot of
Yeah.
condition. There is other factors,
And it should
dehydration.
be kept in all like sports club and gym also should have some knowledge about it, I guess. And they should also have a AED.
Yeah. So definitely, sir. So do we have any more topics to discuss now?
Uh, Yeah, we can wind up, I guess.
Yeah,
We are
yeah.
almost done for the day.
Definitely. And thanks for
Yeah,
sharing your valuable. That was a very different topic today. Was like, what is the impact of uh, maintaining an immobile situation for hours, be it for the sake of work or whatever it is, that's not been explored, and the damages are multifold, as you told. Every system is affected,
yeah,
and the event is unpredicted. It becomes like a sudden cardiac massive attack, which patient may
yes,
not be reliable. So thanks for sharing your views on that. I hope we meet again.
yes.
Thank you so much.
Yeah, yeah. Thank you, thank you, thank you so
Thank
much.
you, ma'am.